First up, the Ga-Chuene Clinic near Lebowakgomo in Limpopo will remain closed despite earlier plans to reopen today. This follows a tragic incident where two nurses on night shift were abducted and raped by an armed man. Now, Health Department spokesperson Neil Shikwambana says the decision to keep the clinic closed prioritizes staff safety. He has advised residents to seek services at nearby clinics. Here's reporter Katlego Nyoni on the ground to give us the latest on developments on this front. So, Katlego, what can you tell us about the decision to keep the clinic closed and how are community members reacting to this?
Good morning, Mkolisi, and to our viewers. Yes, we are right now outside the Ga-Chuene Clinic between Polokwane as well as Lebowakgomo, which as things stand remains closed. Now, this follows a decision taken by the health department in the province that they will have the clinic resume with its operations, which was yesterday the 14th. However, that decision has since been rescinded. This follows a thorough reassessment by what the statement from the health department says, a thorough reassessment on the impact that acts of criminality such as break-ins, robbery, the alleged the assault as well as abduction and rape of the nurses has had on the nursing staff as well as staff in general at the clinic. The department going further to explain that there are still incidents of trauma as well as mental pressure that the staff is still experiencing. The clinic did actually open, however, only 2 staff members reported for duty yesterday. The rest of the staff members that are supposed to resume operations here yesterday cited that they were feeling ill and they were unable to come to work on a day that the Department of Health decided to start with operation. Coming here to the area of Ga-Chuene where we interacted with members of the community, we spoke to a man that is diabetic who says he relies on this clinic to get his routine checkups. That man now says they have to get assistance from clinics in neighboring Khamaja as well as Unit B in Lebowakgomo. However, stating that there are financial pressures on him, that he needs to catch a taxi in order to reach Khamaja, to reach that clinic, whereas the one behind us here at Ga-Chuene is a walking distance. I also spoke to a mother who was on her way to Khamaja, neighboring Khamaja, to have her baby checked in a routine checkup, saying that there are times where they might not have money for the taxi fare, saying that it's a bit of a distance. So certainly the clinic here remains closed.
And Katlego, I'm also keen on finding out if the clinic or the department itself has maybe played a role in bringing about alternative arrangements for these patients to actually make their way to other centers for healthcare to get access to their treatment. I mean, as you rightfully say right now, some of them complaining about the cost implications of having to commute. Do we know if these arrangements that have been made or it's each to their own?
So far, we have not seen common patient transportation that has been supplied by the Department of Health. Only a message, a statement rather, that was released by health officials in the province stating that patients that need medical care can use clinics such as Soetfontein, Khamaja, as well as Lebowakgomo, which are not in this proximity of the particular area. So at this stage, we've not seen common patient transport that is supposedly going to ferry patients from the Ga-Chuene Clinic to other clinics from neighboring community. The department did mention that they are also concerned about the safety of the community in general, following that particular incident, the safety of the community in general, safety of staff members as well, saying that they do not want to rush to have the clinic reopen. However, right now what they are going to do is to reassess and then re-strategize as to how they're going to move forward. As you know, this clinic in Kolisi operates on a 24-hourly basis. It's not the only one. There are 220 others in the province. So certainly the department is saying that they are taking into consideration safety measures of the community, security measures of the staff members at large, and they will then notify the public at a later stage about the future of the Ga-Chuene Clinic.
And I'm taken aback to that very moment where, you broke this very tragic story. Has there been any progress in the investigation into the attack on the nurses thus far?
What we've heard and what we've gathered from the police is that investigations are still ongoing. The assailant or assailants are still on the run. We've not had any particular statement being released by the provincial police pertaining to this crime. We know that the two nurses were working a night shift on the day that the incident happened, and they were then dragged to nearby bushes where they were raped and by these suspects. Then after they overpowered and accosted the security personnel here. So at this particular moment, there has not been any statement from the police indicating the arrest or the suspects in this particular case. But going into the community itself, we spoke to community members who have told us that the crime rate at Ga-Chuene is quite high and that some of them do feel unsafe. We spoke to a woman who mentioned that in incidents where some of them had to use the clinic or walk around at night in an emergency of some sort, they accompany each other and walk in groups. The community does mention that cases of rape are quite high in this area, and they've accused police of not taking any action. We will still speak to the provincial police about this particular issue as we continue with the story.
That's our reporter Katlego Nyoni monitoring developments on that front. Thanks very much indeed for that update.